you today? Fantastic. Right, so just to check, you are here for the cranial nerve examination, is that right? Brilliant. And have you been here before, or it's your first time? It's my first time too, to be honest. So we've got that in common already, a bit of an icebreaker. But don't worry, I have been trained by the best of the best. And all my work will be verified as well at the end by my superiors. But yeah, before we begin, I need to take a few details, so if you can just get yourself comfortable. Take a seat. Would you like a drink? Water, or no? You're okay. Okay, well, just let me know if you change your mind. And I just need to take some basic details, then I'll go into a bit more about what's going to happen today. And yeah, we'll get on. Okay, perfect. So can I just take your full name then, please? Thank you. And your date of birth? Lovely. And do you know your national insurance number? Perfect. And just in case of any emergencies, but I'm feeling quite confident there won't be any. And what is your next of kin, please, or who is that rather? Fabulous. And their relationship to you? Do you have an emergency contact number for that person? I mean, I'm honestly not expecting anything to go wrong, but we have to ask these questions just in case. Okay, so just before we begin the full experiment, I just need to check that you're of sound mind. So a few questions. Do you know what date it is today? Perfect. And do you know the year? And what is the location that we are currently in? Perfect. Just to check, are you currently under the influence of any alcohol, drugs, any other narcotics, tablets and such? Fantastic. Okay, and I just need to take your temperature, check your heart rate, and just make sure nothing unusual is going on there, if that's all right with you. Fantastic. So yeah, I'm popping my gloves on to do that. Just to go in a little bit more detail about the procedure that's going to happen today. So I'm going to be doing a series of tests which will look at lots of aspects around the head and the facial area. We'll be checking some of your senses, your taste, your sight, your hearing and your smell. And I'll also be checking some of the reflexes within the face, looking at pressure points, muscle retention, muscle response as well. Are you allergic to latex, cotton wool, anything like that? No allergies. Perfect. Okay, brilliant. So, yeah, so just need to take your temperature. Don't worry, this is going in the ear and not anywhere else. So, okay, that doesn't hurt, just going in here. Perfect, excellent, 37 degrees, just as we like it. And I just need to check your heart rate, so am I okay putting my fingers on your neck and I can check that? Brilliant. Just keep really quite still and quiet, thank you. Perfect, that's absolutely fine. Just make a quick note of those. Lovely. Okay, so the first test that we are going to look at today is the scent test. So I've got a few cotton wool pads with different smells on them. And they're quite familiar smells, so hopefully you'll be able to recognise them. There's 4 in total, and as soon as you think you recognise it, just let me know, and I can make a note of that. You can close your eyes if you want to, you don't have to. So these are the cotton pads, each one's scented with a different smell. Are you ready for the first one? Perfect, here we go. Yeah, that's right, strawberry, you got that straight away. And for the next one, you ready? Yeah, that is a strong one, you're right, garlic. Fantastic. Next one. Did you get that one? Try again. Yeah, just chocolate, well done. And the final one. You got that one? Are you not sure? Try again. Yeah, it is mint. Well done. Good job. Fantastic. See, now I took a little sneak peek at your medical history. I knew you were going to pass these with flying colours, so you've nothing to worry about at all. Okay, so we've done smell. We're going to look at some tasting swabs. So really nothing to worry about. I've just got 4 swabs here and 4 just little powders really, which I'm going to dip these into. Pop it onto your tongue and hopefully you'll be able to tell me what they are. They're all nice flavours, I promise. There's nothing offensive to anyone at all. And you already said you're not allergic to anything. Brilliant. Okay, so the first one, are you ready? There's nothing to worry about, promise. Okay. Just open wide. Perfect, okay. Yeah, orange, well done. Told you there's nothing to worry about. Are you ready for the next one? Yeah, there's 4 all together, just like the pads. Yeah, so this is number 2. Okay. Did you get that one? Try again. Yeah, it's melon. You don't have to be specific, you don't have to say watermelon, just melon will do, yeah. Okay. And third one. You ready? You can take a water drink in between if you need to. Okay. Right. Okay. Something like that. What do you think? Yeah, that one's mint. Nice good one. And you ready for the last one? You're quite enjoying these really after all. Okay. And here we go. Did you get that one? That one's not as fun, is it? So that was great. Yeah, it's salt. Well done. It means we can test the salty and sweet side of your taste buds as well. So yeah, you are absolutely right. Pass those with flying colours. Well done, you. Okay, so I'm just going to be testing some of your sight now with a couple of different tests. So the first one is I'm going to ask you to follow my finger. Okay, so wherever I move it, if you can just follow the direction, that would be great. But try not to move your head. So if you look at me right now, focus on my nose. Perfect. And as I move my finger, try and keep your head straight, but let your eyes follow the finger if you can. Okay, are you ready? Looking at me? So the next one, very similar. I'm going to be looking at quite a bright light. So before we do a following the light session, I do want to take a look in your eyes. So this is going to allow me to see behind the pupil and iris to the back of the retina, and just to make sure there's nothing underlying or anything that I should be concerned about. Is that okay? I will need to get quite up close. If you do feel uncomfortable at any time, please just ask me to stop. That's not a problem. I promise it's nothing to be afraid of. Okay, so this is the light. Okay, are you ready? As much as possible, you can just look straight ahead again, focusing on my nose. Fantastic. Can you look up for me? And try and look down. Brilliant. I'm just going to look in the other eye now for me. Same again. Focus on my nose. Looking up. And looking down. Brilliant. Well done. Okay, perfect. So, yeah, nothing wrong there with your eyes whatsoever. Okay, so again, I do need to remain quite close up to you now. And again, if you are feeling uncomfortable in any way at all, please just let me know. So we're just going to be doing some touching of your face and on your muscles, just to test your muscle retentions explained earlier. Yeah. And just underneath here, underneath your chin, checking your glands, checking your jawline for any sensitive spots or any lumps or bumps or anything else. Okay, so let's just start just underneath your chin. So just want to put my, there we go. Okay, can you tell me, does that feel okay? Any sensitive areas at all? Does that feel fine? Yeah. Can't feel any issues whatsoever. Just going down to your neck there. And that feel okay as well. Perfect, that's absolutely fine. Okay, so next thing I'm going to do, I'm going to cover your eyes with 2 fingers. You can close your eyelids in a moment, and then I'm just going to ask you to try and open your eyelids. Okay, yeah. Okay, so you just try and open them. Try and open them. Perfect, no issues there. Okay, and I'm just going to do some work on your nose. So I'm going to be pressing those in, pushing it down and pushing it up. Okay, just checking the cartilage and everything else is fine there. Okay, you ever broken your nose or damaged it or anything in the past? Okay, it's just so I can be aware in case there's any issues that I notice. So hopefully no discomfort. Okay, so just giving you a little bit of a wobble and pushing it up and pulling it down. And just to the side and the other side. That's absolutely fine. Yeah, no problems. Okay, so the last test I've got for you is your hearing test. Okay, so I'm just going to give you the squeezer. You can just hit this. Yep, take that in your hand, and you're going to hear a series of clicks, or 20 clicks in total. As soon as you hear a click, give a little squeeze on the pump I've just given you. Yeah, we'll do a practice test in a moment, don't worry. And this is just to check your reflexes and how quick you're able to hear and process that, and how long it takes. Yeah, exactly. So it's connected up to my computer. So as you hear the clicks, squeeze the pump, and it sends a signal to the computer, and we just graph all that. Okay, just want to do a practice one, just so I can check the computer's working. Okay, so as soon as you hear a click, that's absolutely fine. Brilliant. Okay, so there's 20 clicks coming up. Some of them are in quick succession, some of them a little bit slower. As soon as you hear them, give that a squeeze. Are you ready? Feeling nervous? Don't feel nervous. You'll be fine. This is the last test and then you're free to go, so don't worry. Okay. You can close your eyes if you think it'll help you. Yeah, concentrate on the hearing. Okay, are you ready? Brilliant. Yeah, just checking the computer and everything seems to be fine. Perfect. Can I turn that back for me? Thank you. Lovely. So, I think that is all our tests for today. And you've done absolutely fabulous, actually. Yeah, you should be very pleased with yourself. Okay. Yep. We'll get all these results emailed out to you. Don't worry. Perfect. Yeah, we'll send them over to your doctors as well, if that's okay. Fantastic. Okay. Yeah, so maybe see you again. Thank you very much for being my first patient. Hope it's been as calming as possible. Fantastic. You have a great day. See you later. Bye.